We're now going to hear from Peter Wayne. And Dr. Wayne is the Bernard Osher Associate Professor of Medicine in the field of complementary and integrative medical therapies at HMS. And he also serves as director for the Osher Center for Integrative Medicine. And that's at the Brigham and at HMS. He's a researcher and a practitioner in integrative medicine. His primary focus is evaluating how mind, body, and related integrative medicine practices clinically impact aging and chronic health conditions. But since he's a master in terms of Tai Chi and Qigong and these kind of mindful exercise approaches, he really is revolutionizing our understanding of bottom-up processes, how the body informs the brain and hopefully brings about better health. So that's very exciting. His research has evaluated impact of therapies such as Tai Chi and these mindful exercises on balance disorders, Parkinson's, heart failure, cancer, back and neck pain, migraines, and healthy aging. He's the author of the Harvard Medical School Guide to Tai Chi and multiple publications, and he's been funded for many years through NIH funding. So Peter, welcome. Thank you for joining us today.
Well, thank you for the very kind introduction, Greg, and thanks to you and Randy for the invitation to present here today. It's really an honor, and it's an honor to share the stage with Elise as well. Can you guys see my slides? Good. Yep. And they're changing now?
Yep.
Good. So before beginning, I need to disclose that in addition to doing mind-body research, I oversee a community-based Tai Chi school in the Boston area. And I also want to fully disclose that I'm not a neuroscientist. So some of the statements I make about the brain, if they seem a bit off or ignorant, they probably are. So.
But you were trained by E.O. Wilson, so that's a...
Yeah, but my PhD is in photosynthesis and plants, so that didn't prepare me very well. So what I want to do today is in the next 20 minutes or so is just begin by talking about falls in older adults and why it's such a huge public health issue, and then talk about Tai Chi as a unique multimodal intervention. I hope to show you how effective it is. And then very briefly, because it's a new field, just give you an overview on, and it's just gonna be one slide of what kind of research is going on in the Tai Chi brain imaging space. One of the points I wanna make today is that there's not much going on in terms of how structural and functional changes in the brain can help explain the health benefits of Tai Chi, and in particular in the space of movement and postural control. And I think it's a ripe area for collaborative research. So I hope to whet people's interests in this and see if some collaborations can take place. And then what I want to focus most of my talk on are two what I would call top-down processes. Greg mentioned my interest in embodied cognition and sort of bottom-up processes. But things go both ways. And in terms of mind-body training, two of the areas of what we might call mind and mind affecting body have to do with executive function and fear of falling. And this goes into one of the three strategies to responding to stress, which is getting scared stiff. And Elise talked about the freezing. And so talk a little bit about that and how Tai Chi might be helping those, and to ask the question, what's the neural basis of those? So I think everyone on this call appreciates how important falls are in the elderly. About 1 of every 3 adults over the age of 65 fall. Tremendous morbidity. 1 out of 5 of them who have a fracture will die due to the sequelae. The costs to society are huge, and they're growing because of our booming population. And not only are there costs, but changes in balance and fear of falling can really lead to changes in lifestyle behavior with lots of negative feedback loops in terms of psychological health and socialization. So it's really an important issue, and there's no pill you can take to prevent falling. So we're looking at non-pharmacological interventions. There's a lot of risk factors for falls. This is a really high level one. And the ones that I think that Tai Chi are able to move the dial on, and I'll show you some more detail on that, are reducing the risk of falls, and which you'll see is a vicious cycle. Having a fall predicts another fall due to fear of falling. Polypharmacy is a known risk factor for falls, and especially in terms of pain meds, and Tai Chi's benefits to pain might be influencing falls there. Reducing morbidities, mobility, I'll say quite a bit about, but being able to move well reduces falls, and psychological status and cognition. So in brief, we there are lots of different ways to define Tai Chi. This is sort of our working definition. It's a mind-body exercise. We know it's rooted in a lot of different Asian traditions, including the martial arts, traditional medicine, and philosophy. And the training integrates slow, intentional movements with breathing, and of relevance to the presentation today, a number of cognitive skills, including heightened mental focus and body sensation and somatic awareness, uses imagery, visualization, things like that. And the overall aims of these practices are to strengthen and integrate the physical body and what we call the physical body and the mind, these very general constructs, and through that to improve health, personal self-awareness and development. And at some levels, Tai Chi is a very sophisticated martial art. This cartoon gives you an idea of the sort of multimodal nature of Tai Chi. There are a lot of different active ingredients, so to speak. Like most conventional exercises, a little bit of aerobics, there's some musculoskeletal strengthening, flexibility training, but we're not just interested in the pieces here. We're interested in how they connect, how the foot, the hip, and the arm integrate with dynamic biomechanics. So there's integration. A lot of different cognitive pieces here. For example, we use visualization, imagery, and many of the people on this call, Randy and others, have done tremendous work with my colleague Ted Kapchuk. What you think deeply affects how you feel and how you move. And even just saying, feel like you have roots, changes not just the brain, but these somatic experiences of feeling grounded. So there's quite a bit in these traditional practices of using imagery, belief, intention. Obviously, mindful attention to the body. You can think of Tai Chi almost like mindfulness on wheels. It's just a very engaged, practical mindfulness. There's lots of emphasis on breathing, and we heard from Elise that can be important in stress management. Social interactions, Tai Chi is often done in a group, and even philosophy, like maybe doing a little less than 110% is helpful. Go with the flow, a little bit of the yin-yang philosophy. So there's a lot going on in these interventions. And this gives you an idea of why it might be helping with falls. It's a very ecological model. A pharmacological model might take something like an SSRI, and they have a single well-defined molecule that targets a well-defined receptor and changes the system from there. Here you have multiple inputs, changing multiple factors in the system and shifting it in a much more of an ecological kind of way. These are all outcomes from well-designed randomized controlled trials. These are risk factors for falling. So sarcopenia, weak leg, lower extremity strength, stiffness and flexibility, proprioception, recoordination. I'll be talking a little bit about these two processes, and pain we mentioned, and increasing physical activity, confidence. So you get the idea. It makes sense. We have some phenomenological and physiological data explaining these, but like I said, there's very little brain level structural functional studies looking at the links between Tai Chi and falls. These are some recent summaries of the literature. It's quite robust, and I picked some of the more conservative reviews, Cochrane reviews. This is in healthy ambulatory people. See about a 20% reduction in falls, but if you start to include people who are at high risk of falling, these numbers go up to about 30 or even 40%. There's a nice synthetic review of all these reviews by a British young man named Niam, and the conclusion here is that there's good quality evidence for preventing falls for people living in the community. In contrast, there's very little evidence and maybe not as much support for preventing falls for people who are institutionalized or living in assisted living facilities. Just not enough data yet. This is a study I just want to impact how strong this evidence is. And I tend to be conservative, but these are some studies came out by Fuzhang Liu's and Oregon after these systematic reviews. These are not small pilot studies. This is a nice set of studies published in JAMA, about 700 people comparing 6 months of Tai Chi training versus an active multimodal exercise that included aerobics and strength and resistance training, and a seated exercise, which doesn't greatly impact balance, obviously, but is a good attention and engagement control. And what they found in this study was about a 58, after 6 months of training, about a 58% reduction in falls. That's a tremendous number there when you compare that to the stretching, and there are even significant effects when you compare it to the active control. After 12 months of training, after 12 months, so the training lasts for 6 months, there's persistence. And what's really important here is that there's a 75% of reduction in serious injurious falls, which is where a lot of healthcare costs are devoted. So looking under the hood a little bit, I wanted to just say a little bit about brain imaging studies and then talk a little about these cognitive and affective processes. So as I said, there's limited evidence out there. There's a couple recent reviews. You can see the numbers of studies that are included. Many of these studies have multiple publications, so there's a lot of duplicates. I did a very informal PubMed review in preparation for this, just curious. There's about 35 publications that have looked at MRI or structural or functional or some resting state measures and Tai Chi. Probably less than 10 of those are randomized trials. There's a lot of duplicate publications. I want to say a shout out to Jiang Kong, who's been doing some of the best work in this area. He's obviously based at Martinez, and having read some of his work, I've heard him present it a few years ago, but I really want to re-engage and pick his brain on this, no pun intended. There's a couple old EEG studies, and there's, I think, one new study using FNIRS, near-infrared spectrophotography, and I think that's really interesting because of its ability to monitor people while they're actually moving, either doing Tai Chi or some gait design. So I think there's some potential in these more ambulatory, non-invasive measures. There's quite a few studies that have looked at the neural correlates of Tai Chi as it affects executive function, but none of them have gone the next step to say, how does Tai Chi executive function and gait dynamics or fall prevention all link together? So there's no studies out there on that. So we're interested in this space of this, Tai Chi is this mind-body process training. You're aware of your emotional state, you're aware of where your arm is, where your leg is, how you're breathing, the environment around you. And one would think that this would be a rich environment to train executive function and how cognitive and motor interactions combine. And so we've been looking at interference. There's quite a big literature, not from the mind-body perspective per se or integrative medicine, but just from cognitive motor neurosciences, showing that how you think greatly affects how you move. And also how you move also is one of the better predictors of whether you're going to have dementia or your cognitive functional ability upstream. So there's quite a bit out there. There's, for example, one systematic review of large trials, of large cohort studies that showed that even modest deficits in executive function, these are people who are largely cognitively intact with respect to memory, no dementia whatsoever, but have modest deficits in executive function, have a 44% higher risk of falling than those who are normal in terms of executive function. So a lot of literature on that. And what we've been able to do is take this into the laboratory with what we call a dual task paradigm. And it's a simple question. Is there a cost to thinking while you're doing an activity to your balance and gait? And the short answer is yes. This is some work from Jeff Hausdorff, just a simple set of studies he's done. He's one of my colleagues in Israel and one of the leaders in this area. But this is looking at gait speed. We know that gait speed is predictive of falls in older adults. It's also predictive of all-cause mortality and lots of other things. But here's no dual task. Here's phenomes like, give me all the zoo animals that begin with the letter Q, and you have to sort of organize those in your head, counting backwards by 3s and 7s. The greater the cognitive task, the greater the cost to speed. This is a measure of stride time variability here, which is sort of the rhythmicity. And the more variable you are, the poorer your gait health, and the more variable you are, the higher risk there is to falls. It's quite sensitive. You can think of freezing of gait in Parkinson's as the extreme variability where this pauses and then reinitiation. So again, greater cognitive demand, more variability. This is real data from one of the women in our studies. And you can see on the top here, she's walking faster, and you'll see more regular when you see the pattern. Here she's walking quietly. We're not asking her to do a task. Here she's on the bottom at the same time, walking while she's counting backwards by 3s. This is a woman close to 80, so it was a not too challenging a cognitive task. But you can see that, you know, she's much faster here. But if you look at the regularity in these steps here, you can see it's much more regular than the heterogeneity of steps here. So the stride time variability and speed are different. And our real question is, when this woman undergoes Tai Chi training, while she's doing this dual task, will she look more like the performance in the single task? And so it's a real simple paradigm that we can address this cognitive motor piece. Just before I do that, there is a literature, as I mentioned before, on Tai Chi and cognitive function. This is dated, but some of the newer studies don't really change the conclusions, but there's some growing evidence, not anywhere near as robust as the fall data, that Tai Chi can change overall cognitive function in normal aging. It seems to be helpful in people with MCI as well. And there seems to be an especially good benefit in terms of executive cognitive function. And some of that research has grown since this slightly dated review. This is some work by Brad Manner, who's over at Hebrew Senior Life or Institute for Aging. He was a postdoc when he did this. He's now an associate professor. This was not with spring chickens. These are people living in Hebrew Senior Life assisted living facilities. Their average age in the study was mid-80s. Some of them were turned 100 during the study. And what you can see is that just 12 weeks of Tai Chi improved their dual task walking speed. So evidence to support that Tai Chi can help. And also it's never too late to gain some benefits from this. We've also compared healthy Tai Chi experts to healthy Tai Chi naive older adults between 50 and 80. And this is looking at the variability. So the greater the variability, the worse off you are. And you can see these Tai Chi experts had lower variability. We would hope that there'd be a benefit, sorry about that, to Tai Chi, because some of these experts on average have been practicing for 25 years. So if that doesn't make you better, then Tai Chi definitely doesn't work. So this was sort of a cross-sectional demonstrational experiment. We then took these people who were naive and randomized them, and we saw similar trends. Within group, there changes, a small group here, but we saw that short-term Tai Chi training in 6 months starts to move them in the same direction as these longer-term practitioners. We've also been able to do this in Parkinson's disease. It's a small study, but again, the variability in gait during a dual task goes down compared to a weightless control here. Okay. As I said, there's growing evidence, and I can't really speak to the details of these neural networks that have been targeted, but there is some evidence that the benefits of Tai Chi to cognitive function, including executive function, are correlated with plastic changes in both structure and function in the brain. But again, there hasn't been any extension of that to mobility and how executive function and mobility interact. There is some work by Michael Esterman, and we put in a grant that sadly hasn't been funded yet, but we're not giving up. And he's very interested in sustained attention and various networks that are involved in there, in particular the dorsal attention network. Here, this shows in his grad CPT paradigm where you have to pay attention to these transitions in landscapes, that the better your sustained attention is, the better your gait speed. So there's some aspect of sustained attention, that one of the subsets of executive function, that's correlated with mobility. And then some work led by Amy Lowe and some others. This is a conglomerate of databases. We happen to have one from Parkinson's that we shared, so I was involved in the study. Shows an interesting relationship between the anti-correlation between the dorsal attention network, the sustained attention, and the default mode network or mind wandering. So the more attention you're paying, the less your mind is wandering, the better your stride time variability. And what we wanted to learn is whether these relationships extend out to gait quality as well. And that hasn't been done yet. So I want to just shift to this affective level for just a few moments. And again, I think Elise said that when you're exposed to a stress, you have a couple options, and one of them is freezing. And fear of falling it's a horrible thing. It's people who have falls start to change their behavior and their psychophysiology. They walk in a more guarded way. They're distracted by the environment. That fear changes their physical activities and their quality of mobility, which leads to change of fitness, which then makes them more likely to fall, which makes them more anxious, and it's a vicious cycle. And one of the areas that Tai Chi seems to be really helpful is in this affective motor mixture of things. And there are meta-analyses. We can measure fear of falling with validated instruments. And there's some good data to suggest that Tai Chi reduces fear of falling. There's also some mediation analyses that suggest that it's this construct of fear of falling that contributes significantly to fall risk. There's not much psychophysiology study going on or any brain-based research on fear of falling in general, but there's a really cool literature that I happened to cross as I was thinking about this talk around acrophobia, or fear of heights. And they literally talk about one of the hypotheses, going back to Elisa's comment, about getting scared stiff. And it's almost like feigning death. But during height exposures, you get anxious, and that triggers this co-contraction of anti-gravity muscles, and they're implicating the vestibular system here in part. That leads to an increased sensitivity in sensory motor reflexes that makes your body more rigid and therefore sway more. And that sway then feeds back and that instability makes you even more anxious, and you just freeze up. And what I think is happening is that Tai Chi breaks this sort of vicious cycle through an embodied awareness of anxiety. Anxiety is not just a mental construct where you use a cognitive behavioral tool to say, oh, I'm anxious, I know I've been through this, I can breathe. But you experience anxiety by the contraction in your neck, and you're like, oh, I know this state, I can loosen up my neck. I can experience anxiety because I hold my breath, and I've been training to go, oh, I can breathe, and when I breathe, it breaks that cycle. Or my feet are always clenched, or my buttocks are clenched, or I'm in a certain posture. So I think it's this multimodal embodied training that allows people to recognize that initial signal. And instead of getting stuck in the vicious cycle and getting anxious and that anxiety pouring a little bit of fuel on the fire, they get these cues from multiple dimensions in their body, and then they can shift it. And that's my experience in teaching this and watching, but there's not very much to support that. There is some growing evidence now that one of the ways that Tai Chi helps with multiple aspects of health is through improving somatosensation, proprioception, and interoception using constructs that are well validated. We're finishing up a systematic review of this, so I can't show you that data. But there are, we did do those people interested in this sort of embodied perspective, a concept piece with Evan Thompson, showing that the shapes you make in Tai Chi, and there's a good literature of experimental work. By changing your shape, you can change your mood, or changing someone's mood changes their shape and how they move. But there haven't been applications of that to mind-body practices, nor longitudinal studies looking at long-term changes. We just published, this came out 2 weeks ago, a pre-post, it's a very small study showing that in persistent post-mastectomy pain cancer patients, that there's a correlation between the changes in posture, and we were able to measure this in very accurate detail in the motion laboratory at Spalding, but those changes in posture are correlated with changes in things like anxiety, depression, and fatigue. It's not to say that one causes the other. What it says is that it's maybe not appropriate to think of these as separate, that the mind and body are interconnected and that emotion is embodied. This is one of the qualitative pieces from this breast cancer study. And these are just some quotes from these very articulate women who've been through a horrible journey and then went through 12 weeks of this Qigong training. And it just speaks to this sense of becoming aware of these embodied qualities. So I was able to pay more attention to my body. I'm trying to pay attention to where it hurts, the chronic pain, realizing that when you get stressed out, your body can reflect that. It's trying to tell you something, the wisdom in the body.
One more minute, Peter.
Yep. And if something comes up that's stressful, I can actually feel my pulse accelerating, etc. So you get that. So I think it's likely that Tai Chi impacts balance through all of these top-down and bottom-up processes. And to conclude, I think there's good evidence that Tai Chi is good for falls. I think the multi-component nature of it, especially these cognitive, active, affective pieces, may make it particularly useful and give it some value above and beyond just physical exercises or just cognitive exercises. The role of the brain is poorly understood, and I think if we understand a little bit more about which of these networks and structures are being affected, it may feed back on our ability to develop better interventions and target specific populations with unique needs. So lots of people to acknowledge in this work, but I want to just thank you all for listening as well.
That's really wonderful to hear your thoughts about this, Peter. It's wonderful. Any questions for Peter? Not seeing any here. I have several questions, so maybe I'll just jump in. It was fascinating. You're referring to the intersection of interoception and proprioception, and you can really get the feeling that Tai Chi is a bridge between those two very important somatosensory functions. And do you know in terms of neuroimaging or other tools that are being used with Tai Chi to sort of nail that down, Peter?
No, I mean, I think even just the terminology of interoception and proprioception and kinesthetic sense, it's really tricky because if in push hands, for example, you're working with another person or in dance, someone's touching your skin. So you've got some haptic information coming in and you've got proprioception. But if a person is trying to feel how that affects their whole body, when does it go from proprioception on the surface to interoception of how this is moving through your tissues? So I think it's a tricky thing. There are some of the data out there, and I won't botch it by saying much about it, but the insula obviously, is implicated in these interoceptive skills. And some of these imaging studies that have been published have implicated the insula and its connection to other parts of networks, but I'm not qualified to interpret those. But it's an area that I'm very interested in collaborating on. And like I said, this review that we're about two-thirds through is summarizing quite a bit of research on ability of a Tai Chi person to recreate a joint angle or plantar sensation or tactile acuity or recreating movements and emotional awareness too. So it's a ripe area for research.
A really important clinical question, because many of us have older patients who have fear of falling, but also have pain from low back pain and osteoarthritis. What's the literature say about Tai Chi for that kind of pain?
Yeah, no, it's a great question. Chen Wang, who's at NEMIC and Tufts, has done quite a bit of stuff on osteoarthritis of the knee. There's some work on fibromyalgia. We've done some work with neck pain, and there's some positive results there. It's not any more dramatically better than just about every intervention, acupuncture, physical therapy. They all come up with similar effect sizes. What I will say though about the pain piece is similar to fear of falling. There's a huge cognitive piece and the kinesiophobia that's involved. And what we're seeing is in one of the few studies on back pain, a big part of the benefits to perceived pain and disability could be explained by things like catastrophizing and rumination. That Tai Chi is not just changing the strength of the muscles and how people carry themselves, but those behavioral constructs that we know are linked to that. And again, I think that would be really cool to know how do all of these pieces hook up in network dynamics in the brain.
Wonderful. Wow.
I have a really quick comment, Greg, if
yeah,
we have 30 seconds left. I'd be so interested in seeing the efficacy of a Tai Chi-like intervention in a population like cerebellar ataxia, where they have high risk of falls, but also, you know, dysfunction in the somatosensory areas that you mentioned. Do you have any data on that or any
No,
thoughts?
it's funny you say that because we're starting to work with the Spalding group on some head trauma projects, but there are a couple small case studies. One of Ross Safante's students I was looking at TBI and Tai Chi. I think he has a small case studies, I know there's 2 or 3 on ataxia that are out there, but no big studies. But it's just such a complex thing. And the thing to say about Tai Chi is that, you know, what you see in the park and on TV is these complex things. What we teach are very simple phrases. So it's quite adaptable depending on the population. And trick is to make it safe and accessible.
Wonderful. Wonderful. I just want to thank both Elise and Peter for joining us today. You've listened to 2 of the leading lights at MGB in integrative medicine research. So thank you both very much.
Thank you for that.
Thank you.
Yeah.
Pleasure.
Thank you.